Here we go. Hello, everyone. Welcome back to Unfiltered Vet Discussions. My name is Kelly, and I'm with one of our other panelists, Phil. And it's just a one-on-one today between Phil and I, partly trying out a new format because we're creative types and just want to see how this all works and runs. But it's pretty exciting today because Phil has a new initiative. Phil, do you want to talk to us about that?
Yes, I'd love to. Thank you, Kelly. And thanks for doing this. And we were talking about, stepping out into new territory,
Yeah.
trying something new. And, I love the phrase of why not us? Why not now? Like
Right?
what's stopping us? What's stopping us from doing it? Because therein lies the is like, let's try it and see what happens.
Right.
And so I love this. Yeah.
It is fun. And like I told
Right.
you
Right.
before we hit the record button, we're our own limits. So,
Yeah. Right.
right?
And I'll say a little bit like, so this is kind of the story of this program, which is awesome, is kind of one of those things. So we're all, if you're listening and you're in veterinary medicine, we know about mental health issues, in the profession. I mean, we've heard about it, and there's a lot of great work being done by a lot of great people. And so the FVMA, I think it was about 2018 or 2017, we started our well-being committee, and we ended up doing a lot of things, like from changing policies around questions that were asked on licensing exams, on CE, well-being CE that was offered and could be used for our licensing, and just a number of different areas. And we got to this point where it's like, okay, well, we want to have some access. We want to increase access to mental health professionals for veterinarians and veterinary professionals in the state of Florida. So we basically got an EAP, an employee assistance program, but they called it an MAP. And we started that in 2020, 2021. And we didn't have great utilization of it. And that's not really necessarily because of the program itself. It's couple things: is stigmatization of mental health, utilization of mental health professionals in the profession. Cost is one, which we tried to take that off the plate by the FVMA paid for this. And then the other thing that was a barrier that we found subjectively is that oftentimes when we're talking about mental health issues around veterinary medicine, is that mental health professionals, unless they're specifically familiar with veterinary medicine, don't know. They're like other people in the general public. It's like, oh, I thought it was, not minimizing, but oh, I thought it was playing with puppies and kittens. Like I just genuinely didn't know that there were these things going on. And so that would affect trust and rapport and these types of things. So, I was sitting with this and saying, okay, what can we do better? And so two things really came up as the impetus for our new Inspire by FVMA. That's the name of the program. And so number of things. One is that we wanted to use veterinary-informed mental health professionals. So the FVMA and a generous support from Blue Buffalo, Dr. Alex Miller and his team there, just very grateful for the support that they've given us. But we now have any veterinary professional in the state of Florida. So regardless of FVMA membership, regardless of what you do in the hospital, whether like when I was 16, I was walking dogs and cleaning up the kennels, all the way up to the medical director, of the hospital, and the practice managers and the technicians and the assistants. Anybody in the hospital can now get in touch with a veterinary-informed mental health professional. And what do we mean by that? Mm-hmm. We have a veterinarian who is a licensed mental health professional. She's also one of the mental health professionals at University of Florida's College of Veterinary Medicine. We have a veterinary social worker who does coaching. So she's familiar with with what's going on, not therapy, but hey, I'm not in serious psychological distress right now. I just don't know what like what direction I'm going in, or what might I be able to do on an individual basis to, to uplift me in the profession. And we've got a huge bench now of what we call veterinary-informed mental health professionals. So we have one of the well-being director from University of Florida's vet school. She's on board. We have another veterinary social worker who's worked with nonprofits. And then she's really interested in helping our technicians and front desk superstars. And so we've got this great cadre of mental health professionals who understand the profession. And so our thought is, and this is kind of the vision that I'd had. I don't think I was novel necessarily in this, but I had this vision, like that's one of the things is like, from me being in recovery, alcohol and substance use recovery, I feel better talking about, what I'm going through with somebody who gets it. And so that was one of the kind of the thing for me where I was like, let's do this on a bigger scale in Florida. So we have that. So any veterinary professional can get 3 free of charge sessions with a mental health professional in the state of Florida. And they're all veterinary informed. That's one pillar. So a lot of folks are doing things around that, like to get mental health support on an individual or small group basis for team members, which is awesome, that's out there. But that's one pillar. So because we look at the Merck study, we look at some of the other data that we have out there, and about 10% of veterinary professionals at any point are going through serious psychological distress, up to 20% even for people in a role other than veterinarian. So while we need to help those folks, what about the other 80 or 90%, that are potentially languishing or doing okay or just meh? And so what we wanted to do is on a team level, like how can we impact relationships? How can we impact, meaning and purpose? How can we impact psychological safety? And what we did is, so I worked with Michelle McQuaid from the Wellbeing Lab in Australia, international expert in well-being, and we created a certification for creating well-being in veterinary workplaces. Evidence-based tools based on the PERMA theory or PERMA framework of well-being, positive emotion, engagement, relationships, meaning and purpose, achievement, and health, physical health, and wrapping that into the other things that happen in workplaces, with extended or increased job demand, or leadership support, or change management, things that we also know that have impact our day-to-day enjoyment of veterinary medicine and our mental health. And so we also have trained 20 veterinary professionals. I say trained, we're still right now, we're actually just finishing up. And the team members or the cadre or the cohort of these veterinary professionals that are now well-being champions have started to create their impact projects. How are they going to positively impact veterinary medicine in the state of Florida? And so this is now where we can expand this to not just individuals who are going through struggle, but how do we structurally and systemically try to improve veterinary medicine in the state? And so that's one of the other pillars of, of what we're doing is we have this thought of me, we, and us, individual well-being, team level well-being, and organizational well-being. And so we're doing a number of other things to uplift the profession, but those 2 main things, veterinary-informed mental health professionals, we think that's going to increase access to care, and that is for everybody in the state, which is unbelievable that the Florida board or the FVMA board was very adamant that we will do this, but we don't want just veterinarians covered. We want everybody. We want every team member in every hospital in the state of Florida to be able to access this. So like I get goosebumps when, I hear this. So the board was ready to do that. And then Blue Buffalo and Alex Miller and his team, we met, and they were like, we want to be a part of this. We want to help veterinary professionals in the state. And so we teamed up to do this. And then we also have this cadre of of well-being champions in the state, who now we will all get together, and myself as the chair of the well-being committee in Florida, is that we're then going to put out more education, and we're going to also utilize the PERMA tool for veterinary workplaces, which is a unique new tool, novel tool that I helped co-create again with Michelle McQuaid and her team based on their PERMA tool for workplaces, that allows us to measure these things and target what we're doing well, and also where are we struggling, where do we need help, and that we can elevate our strengths, but then also look at the areas that we might need to look at. And an incredibly comprehensive tool that looks at psychosocial factors, leadership, individual well-being, belonging, diversity and equity and inclusion, all of these things that run a hospital. So I am super, super excited. We just launched it. We just put out the first press release on Monday, and we soft launched it a few weeks ago at our Gulf Atlantic conference, and there's already people utilizing it. And then we'll finish up in December with our first cohort of trained, certified veterinary well-being champions in the state of Florida. So there we go. That's a lot. Sorry.
It's a lot, but it's very exciting. But I have a couple of practical questions just to help people who are listening out there, right? Because you live and breathe this and have been living and breathing it. So you actually see the trees and not always the forest sometimes, because that's what happens when you're in a big project. Does anybody know exactly how many people this will affect, since you're talking about all the hospitals and all the teams in the state of Florida?
Yeah, exactly. So let me also say this is like and you know this, is that sometimes there's a visionary, and I'm not like trying to put that hat on, but I saw from, the education and being passionate about this, that we needed to do this on all these levels. But I didn't have all the tools in place to really implement it. And we ended up getting this amazing, so we got the team from the FVMA, and just saying this prior to, I'll get to the question in doing this, but we also got we were very blessed to have the person who used to run corporate accounts or corporate fundraising for Habitat for Humanity nationwide. Like, he worked with Jimmy Carter. I mean, it's just amazing. So Scott Anderson, just shout out to you. And again, the whole team at the FVMA, Jim Noggle, I think. But we're now, one of the things that we saw with our MAP program, that member assistance program, people didn't know about it, was one. People had a hard time utilizing it. So that was one of the goals, that we wanted to really make it very easy to access. And 3 was, we wanted to have it be effective, and then also have an understanding, an idea of how much was this going to be utilized. And so what I'll say is that, to answer your question, we have made, we made an assumption based on the numbers, and essentially we took our MAP numbers and we multiplied that by 5, because we figured we could increase, utilization of this by 5 times with everything we were putting behind it. And we also have the ability, honestly, if it goes up to about 7 or 10 times that, we have the funding, and we have the resources, and we have the infrastructure that we planned for it. And we've got, all of these wonderful mental health professionals, like in the wings, like waiting, let me in, coach, as soon as we need it. So it's a fair question that I'll have more answers for you in about six months. But we planned for this because of the marketing that was going to go, getting this message out. What we didn't know is that Blue was going to be part of this. And so they're going to be getting the message out with their teams in Florida as well. So we're really going to see, and we've already got a email today. I mean, this hasn't even launched really. I mean, it did Monday. We got some, and our mental health professionals are already, they're already seeing, a bunch of people already. So I'm excited.
So that is very exciting. So let's talk about those people for a minute and just break it down, because you were talking about the overall arching and how it all works and things. So I'm a human being in a veterinary hospital, and I hear about this program, and I'm like, crap, I'm having troubles
Yeah.
at
Yep.
home with my significant
Right.
other. Like,
Yeah.
and I think it's really messing me up,
Hmm.
So that
Yeah.
person could go get help with one of the three,
Yes. That
right? Like
person
I'm
could go
like
get help.
specific, like how does this relate
Yeah.
to me conversations,
Yeah.
right?
So that's a good, and thank you for saying that, Kelly, because another pillar is what is our overall goal is to increase access. Our overall goal is not to solve the problem with this program that we've created. The other thing that is one of the foundations, so we have a number of things that, bullet points of what we're doing. One of the other things that we do is how do we give clinics the tools to use what they already have more effectively. Like
Mhm.
to give to your point is like, if I'm having trouble with my significant other or my kids getting bullied at school, you, by all means, you can call one of our veterinary informed mental health professionals. However, those are things that with an EAP, which what we knew so our data, this is also data driven. So our data is about the same as what the AVMA and the Merck study found with EAPs and overall in the country. So we have about a third of veterinary hospitals in the state of Florida that have an EAP. Well, and that's an employee assistance program that you call a 1-800 number or what have you, and you have access to mental health professionals.
Right.
What we know is those are grossly underutilized for a number of different reasons. That's another thing that we're doing, Kelly, is we've put together a workshop on how to effectively use your EAP, what increases access to that, because that means that then we have our EAP, then we may have in our medical insurance program may have other access to mental health professionals, and then on top of that, then the FVMA and Blue have this other program that's there. So that then if we're in the hospital, because that's one of the reasons why our MAP, we assume, based on this is that
Right.
is one of the things that you want to do to increase access to the MAP is a number of things. One is if you're a leader in the hospital, you talk about using the program. Vulnerability, opening up that conversation, because again, what's one of the barriers? Stigma. Am
Mhm.
I gonna, the anonymous part of is my boss gonna know that I use this
Right.
program and possibly use it against me, which is 100% like not, I don't want to say an irrational fear, but it is anonymous, and no, it's not to be used against you in any way. And the other thing is that we have to hit the drum beat, of this is out there. So every time we have a staff meeting weekly, are we given the number for our EAP? And now we can say, and by the way, if there's anything veterinary related, or something you feel like is work related, call the FVMA's, our veterinary informed mental health resource. So that's how our colleagues and friends on the ground in Florida, that's how we're trying to make their lives better individually. And then also, what are the things that we can give their leadership, give them to try to increase the well-being, and the psychological health and safety in the workplace itself as a whole, not just the things that I'm going through personally.
Right.
Yeah.
Exactly. You're hitting it on all different levels, right?
Yes.
And that's great. So action items on this, because
Mm-hmm.
if you hear
Yeah.
about this, but I don't live in the state of Florida, but let's say I did for this example,
Yes. Yep.
like, what do I do? Like, this seems like a really wonderful information, but you
Mm-hmm.
guys, I know somewhere have boiled it down to call to
Yep.
action so that
Yep.
it can be utilized. Because like you said, people are already calling in. So there's things
Right.
like that to be done. But
Mm-hmm.
I think, like you said, mental health is hard. Nobody wants
Mm-hmm.
to talk about it, right? And it's
Yep.
hard to live with it. My daughter's father was extremely mental health ill and then eventually committed suicide. So I know what it
Mm.
personally is
Yeah.
like to live
Right.
with mental health issues and how to talk about it, right? And where do you
Yep.
get help? And then also as an owner of a business, I can tell you
Yeah.
um, policies that we provide employees can be
Yeah.
complicated. Like, how do you get help? And then there's so much, or it's buried, or nobody tells you
Yeah.
these things. And
Yeah.
like you said, bringing these nuggets up for visibility
Yeah.
are
Yeah.
huge.
Huge.
So assuming
So yeah.
website somewhere or like,
Yeah, absolutely. So we have, so fvma.com/inspire is where you can find information about the program. Then we have a PDF that we've been sharing. That's how people found out about it at the conference. Is we put old school, put a flyer in there. And then just again, we're starting to get this in your area of expertise. So we're starting to get the word out with social media. And again, we just had our first release Monday. And then what we'll do is we'll keep drumming that, keep having the conversation. The other thing too is like, how do we get this out there? Is the spirit of what we wanted to do with the well-being champions is that our first cohort are leaders in the profession in the state of Florida. So we put this offer out to people that were already embedded in leadership positions that knew how to get some of this information even better out to local organizations, and help make more of a difference. Almost like in a lot of state VMAs, they have the Power of 10 or the P10 program,
right.
which is an early leadership program meant to get increase interest in organized veterinary medicine, give leadership skills and that type of thing. That's kind of how I described what my vision was for this to the board, was that basically it's a P10 for wellness. And so, but we just have double them, we have 20 instead of 10. But that these folks can then go out into their local organizations. And then the hope is that at least once or twice a year, we'll have cohorts that can then populate into their local areas. And then what we'll do is also give them, hey, you can find your crisis center, you can find this, and then you can go, we'll hopefully go in and talk during a lunch and learn or a dinner meeting, and go around and try to just again say what resources are out there and how we can be of service. But that's the exciting vision that I hope we'll be able to be a model where we're writing everything down so that we can try to share this with other state VMAs as well.
I'm sure they'll be watching to
Yeah.
see what transpires with this program. It
Yeah.
sounds very cool.
Yeah.
Very excited about
Super
it.
excited. Yeah.
Well, thanks, Phil, for coming on today to Unfiltered Vet Discussions. I mean, you're here most of the time, but having this
Yeah.
conversation
Yeah.
with us, because this is kind of a deep dive into this program that you've been talking to us about, the panelists, for quite some times. And I'm like, this is
Yeah.
really, really interesting and really powerful. And it's going to be super exciting as it grows legs and spreads
Yeah.
out throughout the state. When we publish this up, we will have the website as part of the description, so people can come and click on it themselves. You can find this, I should say, on our own social media. So go to our website, unfiltereddiscussions.com, and you'll find us on YouTube and LinkedIn and Facebook and Instagram and X. Come like us, share us. If you know somebody in Florida who could use this program, certainly let them know. Right? That's what you as an individual can do to help another individual in the state of Florida. So thank you, Phil, for the deep dive. And
thank you, Kelly.
It was great. So until later on Unfiltered Vet Discussions, we wish you adieu.